Cool, thanks guys. Hope you guys enjoyed lunch. So our next speaker is Professor Philippa Howden-Chapman, who is part of the Department of Public Health in Wellington. She is one of the New Zealand's leading researchers with a deep interest in lowering inequalities and the determinants of health, housing and energy policies. She is the director of He Kāinga Oranga, or the Housing and Health Research Program. She's director of the New Zealand Centre for Sustainable Cities, and she's chair of the WHO Housing and Health Guideline Development Group. Philippa was also awarded the Prime Minister's Science Prize back in 2014 as a recognition of her achievements in research. Please welcome Professor Philippa Howden-Chapman.
Tēnā koutou katoa, thank you very much, and thank you very much Gisela and Jenny, sorry. Jenny, for inviting me, and I was really impressed to hear that you all had to sit very rigorous selection criteria to get actually in, and you had to write 3 essays, so I can see you're a very motivated audience. Okay. A professor's gown, it's supposed to go under your tie and you can never wear it properly. Okay, is that all right? Can you hear that? Okay, good. Okay, so I'm at the University of Otago, Wellington, and I was asked to talk about leadership, which I've been thinking a lot about. I've run 3 research groups and doing lots of other things. So it was a very interesting opportunity for me to reflect upon it. Okay, this is actually, I think I'm going to have to go behind, otherwise I can't see this. It doesn't show on here, I can see. Okay. Can you see if you can get up on that? Okay, so I thought everyone starts with leadership about, and this has been a theme throughout, what is the personal values that drive you? And for me, it was trying to, thank you very much, thanks. I was trying to increase the public good. The public good is the things that are not provided by the private market because you can't exclude people, so there's no money to be made from it. And I'm certainly, the New Zealand that I grew up in the 50s and 60s was a very different country than the one today. So I was very committed to trying to reduce inequality, particularly in the determinants of health, occupational working conditions. I came down here just after the earthquake to see the men who were demolishing the buildings where I was told there was a lot of asbestos in the wiring and in the roofing without any masks, and right about where the lifts are there was someone with a hose just going like that, keeping the dust down. So I don't think we're very good on occupational health, but I would like to have redistributed money, but I wasn't the treasurer. I wasn't a Minister of Finance. So actually I decided to look at housing, and that's what I'm going to talk to you about now. I get most pleasures and insight from working with an interdisciplinary team. There's engineers and mycologists and economists and physicists in my group. But my background is a clinical psychologist. I worked in an alcohol and drug unit, and I worked as did family therapy, sex therapy, and anger management. The first and last have been very important in my job. I can't say as I've used the middle one much more in my job. But that's very much thinking systemically in the way that David talked about. So we're committed to, in collaboration, working with communities and councils, and have a very strong commitment to the Treaty of Waitangi, which of course requires people to operate at an organisational level and as well as an individual level. So we work with iwi and urban authorities. Now, this is just down from where I live in Aro Valley, and this is, people thought they were coming, the colonial people thought that they were coming from really terrible conditions in Britain, as there were all the tenements and the rookeries, to really good housing in New Zealand, but it wasn't like that. And in fact, in many occasions, the Māori at that occasions, where housing was much more substantial. And right up, in fact, to the beginning of the 20th century, Māori had higher home ownership than Pākehā did. But this is where the conscience part comes in. We've collected, because I was involved in attempting to do a housing thing in Christchurch, I'd been down here quite a bit, and pretty extraordinary that years after those main earthquakes, because of that steep rises in rents, which have only just levelled off, people are staying in garages and in tents. And working in housing, I thought, well, I've got to do something about this. And so that's where the conscience part comes in. There were two particular occasions that I was raised public attention about how housing isn't just about the construction industry. Housing is about the importance of keeping people healthy. And you might remember Emilita Bourne. She was a little Samoan girl who parents couldn't afford to heat her house, and I read the coroner's report. Very worthwhile reading coroner's report. Devoted family, was at play centre in the morning and dead by the afternoon. Obviously some particular sensitivity to the coldness, and the bacteria moved very fast. And in this case, I was persuaded to make a comment. I said, this pretty little girl who was ill one day and dead the next, and that's every parent's nightmare. And as a parent of 3 children, it certainly is. And this is the first time that the coroner said, and coroners are lawyers, remember, not doctors, but he said it cannot be excluded that this house contributed to the death of this child. And if you remember that every year 42,000 children go into hospital for housing-related conditions, and we've just got an article coming out, there is a very high proportion of them who actually die from housing-related conditions. So this was a very significant comment by the coroner. And then there was Mrs. Mulionga. She was a preschool teacher, and she couldn't afford this $170 to pay her electricity bill, and she was needing oxygen, and she died in the night. And this hit the newspapers all around the world. And so although in population health we think about things that can be done to improve health overall, we also thought about the way in which this was presented, and that's in the article down below. I'm happy to send you this presentation if you want to follow up any of the articles. So I focused on housing because that's where we spend most of our time. It's a very important part of the environment, much more important than, in some ways, than the outdoor environment. Because when you breathe air within a chamber, within a room, you're 1,000 times more likely to inhale whatever's in there. But there's no policy agency that looks to the indoor environment. The Ministry of Environment has no responsibility for the indoor environment, and the Ministry of Health has no interest in the indoor environment, to continue a theme. But housing is a very important lever. I chose it largely because it can be apolitical. Everybody needs a house. Now, some people have bigger houses and some people have smaller houses, but most people would not disagree with the fact that people need to be housed. And when I walked up to the physics room, I passed that building that had a fire in it, just along Tuam Street, and I noticed that there was a hand just coming to lock it. So there's obviously quite a few people living in that building there, which I imagine is pretty unsafe and unsanitary. So housing is a very important lever to address the environmental justice and causes of inequalities in health. And also this is an important part about framing things so people will actually listen and do something about it. And this is the idea of co-benefits. If the government is interested in energy efficiency, as they were when we first started, we talk about, first of all, about energy efficiency and then health. If they're interested in health, we talk about that and then have energy efficiency and reduction in carbon emissions. And we always choose something that is solution-focused. In other words, it's no use complaining and saying this is what the problem is and everybody's got problems. But if you identify something not going wrong, you've got to think about a solution. And I believe that's, by the way, the prize for the Prime Minister's Science Prize was for the team. So it wasn't just me. So this is just a graph to show you when children are very young, at this end, this is under 1, and this is people who are over 70, and this is the percentage of their time on the y-axis up here. You can see, this comes from the Time Use Survey, you can see people of your age group who are in here, you spend less time, obviously, at home, and especially if you've got very cold flats, you'll be wanting to stay in the library or whatever. But these are the people, of course, whose thermoregulatory system aren't very good, the young and the very old. So this is really, if we're thinking of an environment, an exposure that is actually critical, it's there. And of course, there's a social gradient in there from houses that are very well built to not so well built. And Jeffrey Rose, so this is from the Bible, a large number of people at a small risk may give rise to more cases of disease than the small number who are at high risk. And this is public health and the population approach. Okay, so just very quickly, New Zealand houses, compared to the rest of the OECD, strangely are very large, but they're very poorly heated, and they're cold and damp. And the average temperature inside our houses is 16 degrees, and I'd say it's probably about, what is it here? Oh gosh, Fahrenheit. It's probably about 19, 20 in here, and probably even higher up the top, and not many of you have got jackets on. But we know that if you're in a house that's cold, or if you're in a bedroom and cold, Japanese work, that your blood pressure will go up. And so to have a temperature of 16 degrees, when the WHO recommends between 18 and 21, is giving people risk of angina and other cardiovascular events. And there are a number of deaths, an extraordinary number of deaths every winter, even accounting for influenza and so forth, which are from respiratory and circulatory problems. And actually, when I was just talking before to a colleague there, when I spoke to the GPs recently at the GPs College, when I was showing a picture of old people who'd gone to bed with a hottie in winter, he said, that explains it. He comes from Invercargill. He said, I was wondering why a whole lot of people come to me at the beginning of winter and say, can you give me some sleeping pills? And I said to them, this is him talking, why do you want sleeping pills? And they said, the house is so cold, I want to be able to go to bed and sleep through the night. Now, of course, this isn't very good for people, because if your thermoregulatory system is not working very well, you need to be moving around. Now, we've got about 1.4 million houses in New Zealand, and only a third of them are insulated. And people on low incomes are more likely to be in older houses. You're all likely, unless you're still staying with your parents or whatever, you're likely to be in flats which are older. They're built to pre-existing, much earlier building codes. And of course, if you've got low income, which is not accidental in New Zealand, Māori and Pacific people have lower incomes, and they live in older and poorer quality housing. So about 20 years ago, I got together my colleague, Julian Crane, who's a respiratory physician, and Michael Baker, who's an infectious disease physician, and we started this housing and health group. And we've done a number of studies, randomized controlled trials, and you all know about those. You get a group of people, you throw the dice, well, you do it on the computer, obviously, and you take one winter you take baseline measures, then you randomize. These are called staggered interventions, what I'm describing. And then the next winter, after the intervention group has got the intervention and the control group hasn't, you go back and do follow-up. And then when it's finished, the people who are in the control group get the intervention. And every intervention, that's our solution. Every intervention that we do is actually provided already by someone. So if it works, and of course you can't do a randomized community trial ethically if you already know it works, then actually it's available to roll out. And so we've done one on insulation, one on heating, one on injury, and I'm going to talk briefly about that because I was interested in David's comments this morning about what they do in the home, and in a sense they've only really just begun what you can do in the home. And this one is rather interesting. We've looked at state housing. We follow through. If you go into state housing, what happens to whether you're more likely to come into hospital than if you were actually in private rental housing. And in fact, you're a third less likely to come into hospital if you're in a state home rather than private rental, because that tends to be in the poorest condition. And we've done work on mold, which shows that if you're in a moldy house, a child is likely to develop asthma, not just the symptoms get worse. And then the last one, the rental warrantor fitness. So I'm going to talk about two of these. The first one is the insulation study, and this is the one that really brought us to the attention of both in this country and overseas, because this is the first time it had been done. The outcome here for the government, which was funding it through the Energy Efficiency Conservation Authority, was to try and, it was after the first oil shock, and they wanted homes to be more efficient and use less electricity. And we thought, Julian and I thought, we knew that hypothermia was an issue in New Zealand with older people getting chilled to the core and then having respiratory and cardiovascular problems. So we thought, I wonder if there's health benefits of this too. So we took 1,400 households all around New Zealand where one member had chronic respiratory symptoms, and we were interested whether being in one of those houses that was insulated would actually improve health. And the first result, of course, was that the occupants in the insulated houses used almost a quarter less energy. So it was energy efficient, but we actually had powered it for mental health, and there was a very large significant health effect showing that if you were in an insulated house, you're much less likely to get depressed. And this was published in the British Medical Journal, because we've still got this colonial idea. If you're going to make a splash, you have to make it in the BMJ or the Lancet. And we had 5 editorials saying perhaps we should be spending money on housing rather than hospitals. And that's continued to be our theme of our work. We're very keen about the process, the way we do it, and I like the emphasis on people who've talked to you this morning about how much is known in the community and how much we should learn from the community. So we went up and down the country. This is Nuhaka Marae just north of Gisborne. We were found when the condition of the houses around New Zealand, we were in South Auckland, we were in the Eastern Bay of Plenty, actually where all this flooding is now, Mingi and places like this, Nuhaka, Porirua, Christchurch and the West Coast. And we saw a lot of mould, and in fact people are now convinced that mould's a big problem in New Zealand. We've just got a grant into the HRC to look at toxic mould, because there's a number of children who are coming to hospital with chorea and other neurological symptoms which seem to be related to exposure to very mouldy houses. And this is the Stachybotrys, this black mould. And apparently, if you can see, so you will all be asked in the census, do you have mould that's more mould in your house than you can fit onto A4 bit of paper? That seems like a very simple and crude message, but actually that's very reliable. We've looked at it against independent people doing it themselves. And mycologists tell us that if you've got this much mould in your house, the mould hyphae could go over the size of a football field. So if you're actually seeing mould, there's a lot of mould in the house. And we identified actually about 140 different kinds of moulds. They're very complicated moulds, because you have to work out whether you're going to do them by species or size or the number of colonies. There's been work. We've got some of the most moulds of any country in the world. Something to be proud of. Forget the sheep. So this was our study, which you can welcome to. You might hope some of you are starting to get it in your studies. So we did both a self-report, but we're very keen on independent measures. So the physicists measured temperature and relative humidity, and we measured a whole lot of things. And we found that children had fewer days off school and work, fewer symptoms of cold, fewer hospital admissions, actually created work, and this became important later on when the Labour government began it, but the national government continued it. Now, the outcome they were looking for wasn't energy efficiency and carbon reductions. It was actually employment, because it was after the global financial crisis. So this is one of these co-benefits that can be shifted across. Interesting, we found that people were likely to move in the study over the 3 years if their house was in poor condition, less sunny, there was a mouldy smell. Some people can smell mould and some people can't, which is why we've gone to a visual thing. So environmental health inspectors, they have to check the mould tests. So some of you will be able to smell it in your cupboards and some can't. So this is one of the big things that we're starting to look at now. When people move around a lot, children move around a lot, The man who was on the radio, the headmaster up at Kyle, was saying the other day that he'd just had a child who'd come to the school who'd moved around 12 times to different schools, largely because of being evicted from rental housing, and was still only at primary school. So it's not surprising there's long tails here. Okay, conveniently, my husband is an environmental economist, and he did the cost-benefit. Exciting thing to do pillow talk about. And he found that there was almost a 2-to-1 benefit, and we looked at a whole lot of things that were a broad range of benefits, from parents not having to stay home as much from school because their child was able to go to school more, less days off work, a whole range of things which economists know how to put a value on. Now, because we realised that we'd only increased the temperature to 17 degrees. Come on, I don't mind. And in New Zealand, we only heat one room of the house. And actually, a Māori kāinga, if you've ever spent time on maraes, traditionally there was actually a fire in the centre of the wharenui, and that was how it was heated. But of course, that's actually really bad in terms of particulates. And so now often they have unflued gas heaters, which is a bit of a problem. In any case, we only heat one room of the house, usually the living room. And of course, in many communal societies, they will shift the children, which are usually in the south bedrooms, into just sleeping in the living room. And if you're in a student flat, you probably don't have a living room now because they're renting those out. So this is if you think of the two parts that use a lot of energy in New Zealand, it's transport, which I've got another group about, but I'm not talking about today, and actually residential energy. So if we make this efficient, that's actually really important. Now, it's a particular problem. We're focusing on rental housing because whereas people always thought, students, they can cope with it for a few years, now we realise, because of generation rent and so forth, that an increasing number of children are being brought up in private rental housing. And children below the poverty line, half of them are in private rental, and about 20% in Housing New Zealand homes. And you see again, Pacific Māori and Asian people are more likely to be in rental housing. And 9% of these households that below the poverty line have no form of heating. You cannot keep warm in New Zealand, even if unless you're in a passive house with a very expensive passive house, you can't keep warm without heating. I got this when I was speaking in Dunedin one. Use fan bake, it heats the room. No. If it's gas, unless you're like Sylvia Plath and want to kill yourself, basically you're leading gas particles into the room. It's an incredibly expensive way of heating, so don't. Now, there's a problem in New Zealand, of course, with asthma. A quarter of children have asthma. Again, it's higher in Pacific and Māori children. And we had a brainwave one day, there was an article in the Lancet saying unflued gas heaters give out nitrites, and basically they irritate the airways. And we thought, I wonder why this is, because we watered all these cheap unflued gas heaters from China, and thinking, well, maybe that's the reason we're getting rising rates of asthma in New Zealand. So we did a randomised community trial, 400 children to have sufficient power, same viso about how we did it. But this time we made sure that they were doctor-diagnosed asthma, and we got them to blow into peak flow meetings in the morning and in the evening. This is the team. We contribute to employment. This is Julian here, won't go on here. My colleague here in the blue jacket on the right. Okay, and then we go around. We talk to people. They've got to choose what kind of heating they want. People in our studies don't have to pay anything because they're giving us our time. So I always raise money from, actually quite a number of district health boards give money. And I know Canterbury has, and Southland has, Hutt did. And this is my husband here, just in case you're curious, at the back. And this is Neville Pearce, who's the deputy of my group. And we always give people kai, and this is people coming in, checking out what kind of heater they want. I've shown you 2 pictures of Māori communities, but actually we're cross-section across New Zealand, because we think housing is not anything to do with ethnicity. It's about the quality of housing and how much money you have to heat. So we were trying to get rid of these wretched unflued gas heaters, but we just told people we were giving them more effective heaters. And so we raised money to get heat pumps, wood pellet burners, and flued gas heaters. And we took lots and lots of measures again. Particularly this time we had someone who was a teacher and could go and look at all the school records. There were 150 schools that she went into. And the results, again, we had very good retention rate. People in New Zealand really like being involved in science. People get very excited by the fact that they are contributing to the common good. So the temperature this time almost got to 18 degrees. People felt warmer. Mould and was much less, and the level of nitrogen dioxide was halved, so the much less upper respiratory infections. Children had less wheezing, fewer days off school, and I'm told by Julian that if you got one of the new generation ventilators that had these kind of results, that would be very, very promising. Of course, if a child is away from school, which is the main reason children are away from school, they miss schooling. And in this school where all the children have their pictures there, if one of your classmates away, the teacher has to then go back and catch them up again. So the healthier the children are, the better for everybody, including them. So more effective heaters increased the indoor temperature, improved the symptoms of children with asthma, and led to fewer days off school and fewer visits to GPs. So we're not doing clinical interventions. We're taking clinical measures because we want to show that this can make a difference. And again, this was published in the British medical journals. They like our stuff. We're now doing a study with older people. These, again, a number of people in Christchurch, which we're hoping to go back and see how these people have fared after the earthquake, because our colleague Ichiro Kawachi did a similar study in Japan and found, interestingly, the people who lost their houses in the earthquake, and he was basically in middle-class communities, the people who lost their houses were more depressed and had poorer health and more health symptoms than those who lost a loved one, which was kind of interesting, but somehow losing a house seems to be much more disruptive to your life than the loss of social networks, which is kind of interesting. So, and we're hoping to look at this in Christchurch, because similar to the it's the Great Eastern Japanese earthquake, parts of the city, the eastern frame and the southern frame have the earthquake, central frame, and the other ones are fine. So there's a sort of natural random experiment about that. Now, these are people with chronic obstructive pulmonary disease, which I see David actually talked about too. You would think the only thing that we know, the literature says, that will keep these people from getting ill is to keep their house warm. And yet half these participants in the baseline had the house colder than they would like and were shivering inside. And of course, once you start shivering, it means the house is probably below 12 degrees and your body's mechanically generating energy to try and keep you warm enough to keep your organs warm. So on the results of those studies, and this is where we do a nudge to whoever's in government, saying, why not roll this out over to the whole country? And this was ECA, the Energy Efficient Conservation Authority, who did a whole series, spent a huge amount of money trying to get people to insulate their homes. And it was, in fact, extremely successful. And we got the contract to look at it over 2 years. We were very keen to do that because we didn't have enough numbers to look at hospitalisation or mortality. But here we had 100,000 people in the first 2 years of the program. The national government spent $320 million on it, and the former Prime Minister said, when asked, that was one of the things that he was most proud about, that he had this Warm Up New Zealand Heat Smart program. And we used a quasi-experimental design. We looked at the people who had their homes insulated and those that hadn't. And we found a small but significant drop in metered energy. There was a significant drop in pharmaceutical usage. So like David, again, we use all the administrative data is available. But most interestingly, if an older person had been into hospital and came out and had had their home insulated, they were much less likely to die because they're often in hospital for those respiratory and cardiovascular things. So that was published in a leading economics journal, and Arthur Grimes, who was the Deputy Governor of the Reserve Bank, worked with us on that. It's very exciting to work with people who've got expertise in the area. I love that little picture. Snug as a bug in a rug. So the benefit cost ratio was 4 for adults. That means for every dollar you spend, you save 4. For children, you save $6. And for people over 65, you also save $6 for one. And by contrast, in Australia, they didn't have the kind of research that we had. They didn't have the support, and moreover, no academics spoke in support of policy. So when they had speed wobbles, it was disastrous for the Australian government. In fact, it was why Prime Minister there, Rudd, fell. So it's been a very successful rollout in New Zealand. So that's the emphasis. If you're going to say there's a problem, you have to find an effective solution. However, the government announced in the 2016 budget that they're basically bored of this program. They're only half the way through. And although there's 600 to 900,000 still to do, they're stopping it. And so I've been in public debate about this. This is where I feel I have evidence that's picked up by the International Energy Agency, the WHO, the OECD. I feel I've got seeing as it was Prime Minister John Key who handed me the Prime Minister's Prize, I'm going to say what I think about this. So Arthur and I did quite a punchy thing on Catherine Ryan about it, if you're interested in seeing it. And she said at the end, why do you think they stopped it? And you can find out what I said if you're interested. Now, one of the things when you stand up, I mean, I know some of my colleagues like who work on food or smoking, they get so many attacks from, whale oil and people like that. There's no really big industry that's opposing me. So in a sense, or my team. So in a sense, we kind of have an easier ride. But even it's quite uncomfortable sometimes. I was at an event with Minister Smith the other day, and he turned his back on me, so I can tell I'm not very popular. But this OECD review has just come out the last 10 years. It's very, very interesting, and those of you who are interested in the environment. And they note with approval that this Warm Up New Zealand program, they think this is one of the most effective environmental programs the government's running. But they criticise the low standards and say, why don't you increase the insulation standards? Because you're having to go back every 10 years to do it up again because you're not doing it properly. Okay, we are also, and I noticed, that hand that was locking the chain into that Tuam Street building. We're really, really concerned about the number of people living on the streets in crowded households. My colleague, Michael Baker, shown this increasing rise in infectious diseases inequalities in New Zealand. And it's going up quite rapidly from 2006 to 2013. So even apart from all the houses that people need because there's new households forming, we've got this huge unmet need here. And again, predominantly children and young adults, ethnic minorities, and Kate Moray worked with the statistics department. Kate Moray is a medical, originally did Med Sci with us, and then has now done a doctorate with us. We're very keen to take people for Med Scis and masters. There are many people, this would count as severe housing deprivation. This is actually where somebody's living, there's electricity geared up to there, the ablution block is there, but it's pretty damn cold in winter. Now I just wanted to, we started 5 minutes late, can I have another 5 minutes? Okay, I'll stop at 0:00. Now, Christchurch, I realise I shouldn't show this flippantly because this is taken minutes after the earthquake from someone on the Eastern Hills. And, of course, there's a lot of sadness going on there. So this is the really important public good arguments here. What needs to be done by the council and the government and Sarah that private people can't do? And I would say housing is a big one of them. So if I'd have been Prime Minister, other than anchor projects, I would have started with housing and then, at the same time as anchor, housing and transport. So I always had my camera out to take pictures, and this is, I thought, was quite a good bit of graffiti. We did a study, and one of those great guys and women, the free-range press people who gave up 3 or 4 years of their life to keep all the art going in Christchurch and to write this book. We did this looking at this inverse care law, which you know about, which is, people who've got usually get more, and people who haven't got miss out. And of course, if you didn't have insurance because you couldn't afford it, because you couldn't afford electricity, you can't even ask for earthquake from EQC money. You have to actually already have insurance. And of course, the red zone had people on low incomes, lots of people with disability. The rental properties dropped dramatically, rents doubled, and so we were making the case that if the government doesn't go in and say this is our job to actually make sure that people are properly housed in affordable, good quality housing, then you increase inequalities, and that's the inverse care law. And I wrote a book about this, Home Truths, for Bridget William Books, which is designed for kind of people like you and ministers and people they're quite short. You can read them in a trip from Wellington to Auckland. And this was the idea that you've got to be thinking about all these different aspects of housing. You can't sell off state houses and then not be monitoring where those people are going. You can't, so I could go on about that. So we said the thing that we've doing at the moment, which is the most complicated thing we've ever done, because the government doesn't really want to have a rental warrant of fitness, we say, we've actually talked to about Treasury and about 12 different agencies, all of whom are very supportive. So we've gone ahead and done it on the basis of all our research. We're working with Wellington, Justin Lester, who's introducing it, and Mayor Cole in Christchurch, and it's a quasi-experiment, so it's going to be Invercargill that we'll be comparing with Dunedin, and Lower Hutt that will be compared with Wellington. And we've got a variation of this logo which Trade Me has agreed to put on, just so you'll know that it meets minimum standards if it's a house. We're way behind everybody else on this. Quickly, one of those injury prevention things that I talked about, this is one of we picked up measures from this because we did another big randomized study, and we showed if you fixed up hazards around the home, you could reduce the number of people going into hospital by 39%. So I would say, I was going to send this article actually to David and say, look, actually you could work getting money, working with people locally to try and fix up people's homes. So if you're leaving people not just homeless but in dilapidated houses, you're costing hospital money. And this was in the Lancet. So this is our rental warrant fitness. Actually, because the government said, no, we don't want to do this, actually the councils came to us, and 5 councils in the New Zealand Green Building Council. That was very successful. And even the landlords thought it was quite good. We've gone a foray in my frustration with not having houses designed for 3 generations, which of course there's a number of different ethnic groups and even co-housing of young people who would like to live together in a house where there was enough space. And we've built this in Porirua, and this is the blessing of it. Okay. I think my message to you today, it's important that we all speak out. We've got to speak out with due humility, because there are lots of different opinions out there. But if you've got evidence, you should speak out about it. Our rental housing in particular is very poorly maintained, and that's a health hazard. We must insulate and heat houses, because that's where we spend most time. And it's important how we frame it. We can't, when we did that thing about Mrs. Mulionga, we noticed that lots of newspaper articles would say, oh, it's her fault. It's her fault because she was overweight, she was obese, and that's why she got a pulmonary condition, and that's why she had to have oxygen. She should have lost weight, and they should have found the money to find the $170 to pay their bill. So it's very easy to blame people for living in bad houses, but we know that landlords discriminate against people of colour and anybody who's got children. So some people have very few choices. So the positive messages. to go out and invigorate you to go and do good, is that robust research results, the way that you're taught medicine and so forth, particularly if you can find someone who's got some economic knowledge. I can recommend it. Cost-benefit analysis, that's the way to grow cross-party support. And Minister English said to me once, oh, we like your stuff because we know that if the cost of insulating the house, that will last for 30 years. You've only got to stop one person going to hospital in that 30 years and you've paid off the insulation. And also it's very important for co-benefits. It's one of the key things that you can do to try and reduce carbon emissions. And it's good for health, good for energy efficiency. And always suggesting a solution. Focused research makes policy and also political engagement easier. It's like when I was a family therapist and I'd say to people, now don't say you should do this. You have to say, I think that, and always own it I. So we always try and say, our view is that this would be a very effective intervention and you would save money. Thank you. Okay, give me a couple of questions. Oh, well, so, yeah.
I'm just curious, because with the, I'm not sure if you know the answer to this, but with
probably
the
not.
change the Residential Tenancy Act,
Oh, yeah.
about conservation and residential conservation.
I do know that.
Is that, and also the current bill in Parliament, bill in Parliament
Yeah.
for the healthy homes.
Yeah. I do know all about that. I've consulted widely on that.
I'm sure what I want to know is, does that apply to state houses as well? Houses as well?
Yeah, the Residential Tenancy Act does apply to state houses, and I give Minister Smith credit for that. Actually, we wrote a paper, we got hold of all the cabinet papers, which you can get hold of, and he was actually in support of something much stronger, but he doesn't carry much weight at all. Is this being taken? He carries less weight than other people in the cabinet. And we asked him if comment on it, but he didn't, so we presume that that was actually reasonably accurate. Well, it's all in the documentation. Basically, as I say on that Catherine Ryan thing, the problem is we're now on the very low, but 2008 insulation standard, which is about the size of a bag of sugar. I was told off for that. This is about the size, thank you, of the insulation for 2008. When 1978, which the minister has said is fine if you've got some, and it was originally put in, it was the size of a coffee cup about up here. And if it's gone down to the size of a teacup, so you're keeping it just about this height, that's okay. So this is where you get into politics. There are very good landlords. By and large, landlords go with the National Party. So they do not want to people are kind of concerned about their constituency, just like Labour is more involved to be the unions, farmers and landlords are more likely to go with the National Party. So, to give him his due, Nick Smith was probably being quite brave to even bring it on the political agenda. Yeah.
Thank you so much for that.
Stop me when you need to.
My question is regarding awareness and advocacy. So your talk was really good for our awareness, and we can read up the papers, but how can we as students do more advocacy around this? And you've given a lot of points, so what are the key biggest contributors that would be
Actually, somebody asked me that morning too. Put your hand up. Yes. That's a very important point, and we spend a lot of time in the group working out what issue are we going to take on. Like I've just applied for a Marsden grant for evictions, which that's another terrible story. But we can't do everything at once, so we're concentrating on private rentals and trying to stop. I'm looking at evaluation of the sale of state houses. But basically, we think private rentals is the most important thing. An important thing is really to work alongside other coalitions. And I was saying that there's Renters United, which is the student union, the overall student union works with. That is really, that's getting quite a lot of coverage, and it does everything from asking students to write in their stories about renting, or to actually go in and make submissions. And students, because they're at a stage where they can vote across the spectrum, and they're often going to be professional people, they often carry a lot of weight. So I do think, especially you as doctors, remember what Virchow said, that politics is medicine writ large, but medicine is politics writ large. Which way around does it go? Both, it can go in both directions. But in any case, I mean, what I was saying as a research leader and originally a clinical psychologist applies to you as doctors too. You can actually have a lot of clout. But it has to be on the basis of evidence. But there's students who did some work before, did this amazing theatre on Cuba Street of a child with rheumatic fever, and it was very, I mean, you've got to look at all the talent that you've got. You could use art of various kinds to get your point across about how cold you are in houses and how much you shiver.